Hello everyone, I'm very happy to be here in Belfast. It's my first time. I'm coming from Italy with very good weather as well, so I'm very pleased to find this. I'm a project manager at the Autonomous Province of Trento in the health department in the Research and Innovation Office. And I work in close cooperation with Oscar Mariora, who's working at the Research Center in the Autonomous Province of Trento. Together, as Henry had said before, it's the same. I'm not a specialist of health either. I manage different EU projects dealing with e-health, but today I'm very happy to present a digital innovation that we worked on with the Research Center of Trento on personalized medicine, which is the prescription-based health application that we made on a mobile phone. So just a little bit of information about the province of Trento. It's an autonomous province. It's a small region of Italy on the north part of Italy. It's at its own government and its own laws. So it works. It's a small region with approximately 500,000 inhabitants and a good GDP and very low employment rate. So we can implement easily some new project and research because we're so small and have so many people, so we can try new things easily in our region. So a little bit of information about the health service in Trentino. We are mainly public at 96%. 96% of our services are given by the Health Trust of Trento, with 7 hospitals and all the valley with the mountain hospital and the different valleys of the Trentino. And we have about 1.2 billion euros of budget every year for the health in Trentino, with 1.3% in innovation. So general context that we heard about a lot today, that we, in our industrial world as of today, we have an increased number of elderly people, a very rise number of chronic diseases, and no sustainable costs. So this is a big challenge in the EU, and so we thought about a tool to face these challenges, which is this app that I'm going to present. Just to let you know that we have our own law in Trentino, so the research and innovation, the e-health in Trentino, was made health inside the health protection law in Trentino since 2010. So we can work on it for about 10 years without any problems, because it's validated by our government. In Trentino, we developed a business model with a 3-helix model that we want to become a 4-helix with the industry. But for now, we have the institutional parts of the Trentino, which I represent, which is the province, and then the research center, which works with the university as well, and the health trust. And we would like to work more with the industries, the startups in Trentino and elsewhere to become a 4-helix model. Now I'm going to talk about this famous app that we developed. So the observation that we made is that the health apps are used by a lot of people, and there was it increased a lot from 2013 to 2015. It doubled, and we saw that there's a trend of personalized treatment for chronic disease, for example, with the variability of genes and the environment and the lifestyle. So what was the main issue to respond to these observations? It was that these apps were not approved legally or clinically. They're not certified, and they're not approved by the RCT, the randomized controlled trial, and they're not as well integrated in the clinical system. So what do we do? Our proposal was to, with all these problems that we saw, we have developed this app considering the legal, clinical, and personal aspect of the patient. So his environmental and behavior factor, his medical history. So it's all in his electronic health record that we saw before with the ML Health. And all the external devices, for example, the lifestyle apps, but also your monitoring devices that you can have for cardiovascular issues or stuff like that. So with all of that, we create a personal support for disease management. We can be made for each patient. The technical aspect that I won't enter a lot because I'm not a professional about this, but it's based. This app is based on a framework which is called Trek, and is positioned between. It exists for about 10 years now, and is positioned between the personnel, the medical people, and the patients. It's the system, it integrates information from both the patient, his data, his lifestyle, his information that are linked with his application. It's always already done with some application that we made in Trentino that people are using, and the clinical the information made by the professionals. So it looks, this image is a little, makes me worry a little bit, but it's quite easy to understand. All the personal health record, this is the big table on in the upside left side, as all the information from your electronic health records of all your information when you go to take your blood test. It goes all on the personal health records. And also, for example, all the doctors' appointment goes inside the PHR also, for example, and also all the information coming from the health and well-being devices that we link to this platform are going to your PHR as well. And like I said before, we want to also enter a third party to all the other apps, for example, who exist on the market for now. We want to make partnership with them to enter their information in our PHR on the Trek system. So information about Trek today, it is used by more than 100,000 people, and it's the app that we launched about a year and a half ago already has about 2,000 people, and used mainly by elderly people who likes that because it's easier for them to use on their mobile phone than on connecting on the computer is more difficult for them. So it has all the clinical information about the patient, even like coming back from 25 years ago, and it's validated. It's secure it's all secure data management with all the clinical information about the people. It has been tested. And as I told you, it integrates also the well-being information with the life trackers and health coach that we have. Because our application, we have also a lifestyle application which is connected to the Trek platform. How it works? We have two platforms. One is in production, and one is a living lab. So one that we can use today, that people can use on the app and on the internet, and one is in production. And so people, researchers, and from FBK and the Health Trust are working on it for developing new information, new application, new details in the platform right now. When it's validated by the government and the business model, for example, it goes directly to the living lab. They're exactly the same, so it's pretty easy to work with, and it's fast. So they're the same. Now about the app. There's three dimensions of personalization of this app. The first one is the health personalization. It takes all the information from the patient from 25 years or 30 years ago to right to now. So it has all these information of the condition of the patient. This app can be prescribed by the doctors for a period of time because like a medicine, you can prescribe it for a month, 2 months, a year, for example. And it's personalized depending on the patient social abilities. For example, we prescribe a different app for young people than a senior person who can maybe has difficulty to use the app and look at his cell phone regularly. So the doctor can decide to do a step-by-step approach with the patient, because if he has he's young, he's older, he has different habits for the food. He has complicity to eat regularly. So the doctor can think about the different types of patient he has to prescribe the different type of apps. So because these three dimensions are like the prescription of the apps, this app prescription becomes a medical act directly, and it's part of the medical. It became part of the medical legislation. Now I'm going to launch this small video so you can see how it works in real life with the doctor and the patient. The doctor prescribes the app like he would prescribe a pharmaceutical.
Buongiorno. Il medico convoca il paziente e decidono di utilizzare l'app per un periodo predefinito. Compilano quindi insieme il profilo paziente. Informazioni come il tipo di diabete, il livello di istruzione, il profilo clinico, gli stili di vita e così via. Ora il medico può gestire i molteplici aspetti della cura del paziente. Da questo menu potrà infatti prescrivere l'app, personalizzare il piano di cura base, cioè farmaci, esami, task, attività fisica, eccetera. Potrà personalizzare il piano di cura avanzato, cioè decidendo che dati clinici l'utente può inserire, attivando i questionari, gli esperimenti personali, i goals, i moduli educativi, l'educazione contestuale, il microlearning, mentre nella sezione monitoraggio il medico può attivare il telemonitoraggio, i report mensili per tenere sotto controllo il paziente. La dashboard permette di visualizzare i dati inseriti dall'utente in comodi grafici e infine la sezione conversazioni permette di comunicare con l'utente tramite dei messaggi, chat. Quindi il medico dal suo cruscotto web prescrive l'app e la personalizza per il paziente. La app infatti appare molto diversa quando sono abilitate solo le sezioni di default, mentre abilitando i goals, gli esperimenti personali e altre funzionalità, le sue componenti cambiano radicalmente. Il medico può prescrivere uno o più farmaci al paziente, impostando durata della terapia, dosi, ore di assunzione, eccetera, dettagli che il paziente vedrà sotto forma di promemoria nella sua app su smartphone. Oltre ai farmaci, il medico può prescrivere dei task, ovvero misurazioni ad orari specifici, come ad esempio misurare il peso ogni settimana.
Va tutto bene, ora inserisca lei i valori che abbiamo appena misurato, così poi li vediamo all'interno della cartella. Poi io se ci sono dei problemi lo vedo qua sul cruscotto, se non ci sono mie comunicazioni lei continui con questa terapia, con questa attività.
Bene, grazie dottore, grazie mille, arrivederci. Arrivederci.
But this application helps our issue of organization of the health environment right now, because there's too many patients and not enough doctors. So, for example, for diabetes, we are using this app right now, and so for example, the Trentino is a region with different valleys far away from the big hospitals and health centers. So people can, for example, diabetes can be monitored by this app. So this app is connected to this virtual coach who helps you monitor your diabetes information, which are sent to the call center with personal trainers, counselors, and nutritionists who can see the information that you report on your application. And if there's any issues, the call center sends an information, a red light, to the doctor who can make an appointment with you, and the person can come from the valley, for example, to the center, the health center. But it reduces a lot the appointment for the doctors, and it helps, and it reduces also the time consuming for the patient who don't have to come to the health center every time they have to check something on his diabetes. So it's a good model for other chronic disease that we want to develop in our region. So in conclusion, this smartphones application we think they have a great potential for the implementation of personalized medicine, and specifically for personalized treatment and chronic diseases. So TREC platform enables us to manage this issue, and we can use the same platform to do different apps for different chronic disease. And for example, our institution are evaluated on this issue with institutional goals right now. So it's something we want to keep on doing and improve in the future. And we're going to continue working on this app prescription based with our PHR ecosystem to integrate more application in the prescription health system. So right now, as I told you, this application is already used as a pilot study for diabetes type 2 and diabetes type 1, and we hope that to develop it for other chronic diseases in the future. That's the end. Thank you for your attention. If you have any you need any information or details, please contact me or my colleague at the Research Center, Oscar Mayor. Thank you so much.